Hello, welcome to Health Talk with Dr. Toyin. Today we'll be discussing infertility. Infertility is the inability to conceive despite regular sexual intercourse of at least 2 to 3 times a week. In a woman less than 40 years, this should be for at least a year, and for women more than 40 years, it should be for at least 6 months. The causes of infertility include things like obesity, which is when the body mass index, which is the ratio of the height to the weight, is more than 30. Smoking can affect the chances of conception. Excessive alcohol can affect the chances of conception. Problems with the female reproductive tract, from the cervix to the womb to the tubes, things like fibroids or endometriosis or blocked tubes due to infections or adhesions. Problems with ovulation can cause infertility. Poor quality or reduced quantity of spermatozoa can lead to infertility. In a large number of cases, there is no cause that can be found for infertility. The tests that can be done for infertility include blood tests like full blood count to determine if there is anemia, which means low blood count level. A thyroid function test can be done to determine the thyroid function. Blood sugar can be determined to rule out diabetes. Hormonal assays like measurement of follicle stimulating hormone and luteinizing hormone, which is usually done in the first 5 days of the menstrual cycle. If there's any confusion as to how to calculate the menstrual cycle, please refer to my video on using the calendar method for contraception/conception. Progesterone levels are measured 7 days before the next expected period. In a 28-day cycle, this would be day 21. And in a 32-day cycle, this would be day 25. In the male, semen analysis is done to determine the quality and quantity of sperm. An ultrasound scan might need to be done to rule out things like fibroids or endometriosis. A hysterosalpingography can be done where dye is injected through the cervix into the womb and outlines the tubes to see the patency of the tubes. Infertility can be treated in a number of ways. First of all, it would be a good idea if your body mass index is more than 30 to try and reduce it to be below 30. If you're smoking or you drink alcohol excessively, it would be good to reduce this, both in males and females. You'll need to calculate the right time to have intercourse and have it at least 2 to 3 times a week, as outlined in the definition. If the cause is something like fibroids or endometriosis, this might need to be dealt with either medically or surgically. For some people, what is called a laparoscopy is done, whereby a camera is inserted into the abdominal cavity to see if the structural cause to infertility. Artificial reproductive methods like in vitro fertilization can be used if there are problems with either with ovulation or sperm count. Something you will not find in the textbooks: worry or trying too hard in quotes can actually delay conception. There's a way it works with the hormones in the body that it makes conception harder. So what I would say is relax. Enjoy the process while you're trying to get pregnant. And it might just come when you least expect it. I hope you enjoyed today's teaching. Continue to watch, share this video, subscribe to my channel, and until next week, smile because it's healthy. Bye.